Hi, everyone. Welcome to the Concussion Discussions series brought to you by Integrated Brain Centers. I am your host, Amy Zellmer from Faces of TBI. And today I am here with Dr. Ayla Wolf from Healing Response Acupuncture and Functional Neurology. And today we're going to be talking about Chinese medicine, a multimodality system with applications in healing brain injuries. So welcome, Dr. Wolf. So excited to have you here.
Thank you so much.
So maybe let's just start with the basics of what is Chinese medicine, and how did you become involved in it? What called you to working in it?
I knew from the age of 6 that I wanted to be an herbalist. And so I have been essentially studying plant medicine from pretty much the age of 15. I actually started working at a health food store when I was 15. And started studying herbs pretty seriously from that age on. And then I discovered naturopathic medicine and moved to Australia to study that for a while. And while I was in the process of doing that, I started to just independently become fascinated with the crossover between herbs that were used in both more of a Western herbal medicine approach and a Chinese medicine approach, and became very fascinated with Chinese herbal medicine. So when I came back to the United States, graduated from my undergrad, I then enrolled in a master's program in Chinese medicine, coming from the place of actually wanting to learn Chinese herbal medicine. And of course, acupuncture is, I would say, an equal part of the program. And once I started learning acupuncture, obviously fell in love with that right away as well. So that's kind of how I got into it. And the reason why the title of my chapter is called a multimodality system is because when people think about Chinese medicine, they usually think immediately of acupuncture. And I think we make that even more cemented in people's minds because we call ourselves acupuncturists more frequently than using the term Chinese medicine practitioner, which I think is a better term because it encompasses a lot more of what we do, which includes the Chinese herbal medicine, nutritional aspects, dietary therapy, lifestyle aspects, as well as what we would call the Qigong kind of umbrella of different movement therapies as well.
Yeah, it's really fascinating when you kind of do start diving into Chinese medicine and all that it really encompasses and all the different things that you can use in conjunction with each other. So how did you go from, 15 years old working in herbs? How did you go from there to, doing your Chinese medicine training? And then you also have your functional neurology diplomate. So how did that all tie together?
I started out specializing in fertility and women's health, and that led me down the road of studying a lot of aspects of hormones, which got me into functional medicine and trying to integrate Chinese medicine with functional medicine in regards to balancing out the hormones, helping with fertility, and then just general women's health. But then because I've had a couple of my own concussions, I had to become very interested in how do I get my own brain working better and recover. And then that's what really led me to shift and start to study all different aspects of concussion recovery. So not only how can you apply Chinese medicine to the process of helping people recover from a brain injury, but then I did go on to study functional neurology and clinical neuroscience through the Carrick Institute. And that really led me down, I would say what felt like a completely separate track of education and learning. And then it took me a long time to come back and integrate the approach of functional neurology to what I was doing with acupuncture and Chinese medicine. And what I really started to recognize is that the more that I would do comprehensive functional neurological exams for my patients with concussions and brain injuries, and then use acupuncture as an intervention and then re-examine the patient, I started to realize the power of acupuncture on improving brain function. And so I started to find a lot of integration between utilizing acupuncture along with vestibular rehabilitation techniques and ocular motor and proprioceptive rehab and all of these other aspects of, gait retraining and balance retraining, cognitive activities, and creating a very integrated system of all these other functional medicine kind of approaches and tools and techniques with the acupuncture and the Chinese herbs.
And can you give us like a really easy to digest version of how does acupuncture work? We all know it's these tiny little needles, but how does it actually work? What are you doing with the needles?
We could break it down into a number of different categories, meaning that when you insert a needle into the body, it has a local response. So there's a local response that occurs where different chemicals are released in the body that allows for improved blood flow to that area. And then changes in immune function too, so that the immune system can actually kind of, appropriately address certain injuries or scar tissue or whatever may be going on in that local area. So that's one mechanism. Another mechanism is that when you insert needles, and especially when you're stimulating them with electroacupuncture, you can have a major effect on nerves. And those nerves then obviously send a lot of information into the spinal cord. And so you're now also having an effect on what's happening at the level of the spinal cord and the innervation to all of the organs, tissues, muscles, bones that area is related to. And so we've gone from like local aspect to specific nerves to spinal cord, and then all of that sensory information when you insert an acupuncture needle or multiple needles goes up the spinal cord and into the brain. And certain points we know have different responses in the brain. So, there really is a specificity to which points are utilized, and different points have a big difference in how the brain takes that information in and responds to it based on how our nervous system is wired. And so that means that we can use specific acupuncture points to have an effect on the central nervous system and how, what parts of the brain are responding to that stimulus. So it's complicated. There's nothing simple or easy about piece of it. But that's also what makes it so amazing.
Yeah. Yeah. And I think the average person doesn't fully realize how much training goes into becoming an acupuncturist. You know, I've been pretty amazed at what I've heard from some of my survivor friends, talking about vestibular and dizziness and how it really helps calm them down. I have one friend that does, I believe it's called like the battlefield technique in her ear. And that really gets her by, she does it monthly. Yeah, so I've heard really incredible stories from people who have turned to acupuncture for relief from the different symptoms of TBI. And total side note, but I recently was in and you were doing my regular treatment and I had a horrible toothache because I needed a new filling in my tooth. And so I had to wait a few days till I got it done. And so you did a point somewhere in here on my cheek and it turned bright red. I remember I've never had a point turn red like that. And the pain was gone. It got me through until I could get back in to get the filling. So that was pretty cool.
Yes, I always say a point for every ailment.
So maybe tell us a little bit more. I mean, we've talked broadly about your fascination with Chinese herbs, but maybe tell us a little bit more about how Chinese herbs can help us with different conditions.
Definitely. And I think one of the biggest confusions about Chinese herbs is that when people hear Chinese herbs, they don't realize just how vast and broad that of a category that is.
Yeah.
And the fact that there are hundreds and hundreds and hundreds of different formulas. So the biggest difference between what you might call a Western herbal approach versus a Chinese medicine approach is that a lot of times Western herbs are used as a singular therapy or by themselves. Classic example, echinacea, right?
Mm.
People getting sick, let me go run get some echinacea and take that by itself. Or another really popular one for anxiety and nervousness is skullcap. So this idea of let me go buy some skullcap and take that as a single herb to address my anxiety, for example. Chinese herbs are very much like baking or cooking, where if you're baking a certain cake, then you're going to have all these separate ingredients and you're mixing them together in very specific quantities based on the outcome of what you want that cake to look like. If you want it to be much more fluffy, you might use more eggs. If you want it to be very dense, you might use more flour. And so with Chinese herbs, if you have 10 people that come in with a headache, for example, each person might get a different formula based on the quality of their headache, whether that is a migraine or a tension headache, whether it's throbbing or more of a dull ache, whether it's almost like an empty feeling or like a heavy-headed feeling. So in Chinese medicine, we ask so many specific questions to really dial in what we would call a differential diagnosis for what is out of balance in that person that's triggering that specific kind of headache. And then that, like I said, 10 people with a headache might get 10 completely different formulas. And so that's the piece that I think is so important for people to understand, that when we say Chinese herbs, what we're really saying is that this is a system of herbology that is extremely individualized for the patient.
Mm-hmm. Yeah, and you ask a lot of descriptive questions, which I think is really cool. And sometimes it's hard to come up with an answer, like describe how it feels, and you're like, because we're never like forced to describe it. Nobody ever cares. So it's a different experience in a good way. Yeah, it's lots of descriptors with you.
And we're always taking into account the person's unique physiology too. So again, if you have two people coming in, say with a migraine headache, again, those two people might get entirely different formulas. If one of those people also is having, massive hot flashes, for example, or the other person has issues with diabetes or blood sugar regulation. So it's not even just about a headache, it's really taking the entire person's physiology into account and their history and their makeup in terms of, again, really getting specific about what somebody needs.
And you also mention in your chapter a little bit about Tai Chi. Would you like to share a little bit more about, I think most of us probably know what it is at a really basic level, but how are you integrating that in with what you do with your patients?
Yeah, I talk a lot with my patients about this idea of making sure that the map in the brain of the body is very accurate. And so we have, when people have a concussion, a lot of times the parietal lobe is impacted by that, and as well as the vestibular system. So the parietal lobe is where we have a sensory map of all of our body parts, and our vestibular system is, what tells us kind of where our head is in space. Mm-hmm. And so if those two systems are not working so well, and then you can also obviously bring in the visual system as an important piece of information too, an integrative piece, then all of a sudden people don't know where they are in the world. And that can actually create more problems than we might realize in terms of people with a concussion then hitting their head again. And I hear really frequently from people that have had concussions is, man, ever since I had this concussion, I feel like I'm constantly banging into things, or I'm more clumsy, or, I just feel like accidents keep happening. And part of that is, that sensory integration with understanding where exactly our body and our head are
Yeah.
in space in relationship to all the objects around us. And what I love about Tai Chi is that very slow, very controlled movements, but it's also lots of rotation, and it's a lot of movement that we don't make in our day-to-day lives. And there's a cognitive component of having to really be focused on these very precise, exact movements that are, again, kind of a lot of times new to people, or not normal movements that we make in our day-to-day life. There are lots of circular motions. There's lots of twisting movements. There's lots of movements where you've planted your foot and then you're rotating before you pick your foot up and then place it somewhere else. And all of that gives us a lot of proprioceptive input through our feet and our ankles and our knees and our hips. And then we're simultaneously having to match, say, a head movement with a hand movement. And there's so much integration that has to happen in order to perform a Tai Chi progression. And that really has such a positive and powerful impact on that vestibular information, and then on the proprioceptive information that's going into that sensory cortex in the parietal lobe. So I feel that Tai Chi, for all of those reasons, can be an incredibly powerful recovery aspect for people with brain injuries.
And, I assume when you're getting a lot of brain injury people that also have physical injuries on top of it, right? Like they were in a car accident and, they might have had whiplash, they have a neck injury, or someone might have taken a fall and broken a bone in their accident. And I think the cool part is how you're able to integrate what you do with both the brain and the physical body, right? Like as far as would you call a broken bone a wound treatment? That's the only word I can come up with. But yeah, tell us what approach you would take with that.
What I love is that the acupuncture is not just affecting somebody from a local injury perspective. It's actually affecting them from the central nervous system and the brain perspective as well. And what happens with people with concussions that have these concurrent injuries, whether it's a traumatic neck injury or a broken bone, or say like with car accidents, there's just a lot of shoulder injuries.
Seatbelt.
Yeah. So we can definitely address acute trauma. And I also use a lot of photobiomodulation in my practice to help too with acute trauma and bruising. But what happens with brain injuries is that a lot of times those acute traumas do turn into chronic pain. And it's because that the brain plays such an integral role in pain inhibition. And if the brain if the brain is injured, it's failing to inhibit the pain. And I got to experience that myself, where I had an injury. I had my scalenes ripped off of my collarbone, and I tore my sternoclavicular joint. And I was walking around in pain where it felt like I had a broken collarbone for a year and a half. And it was at the same exact time, like I had had concussions with that injury. And it actually wasn't until I started working on my brain and recovering from the concussion that all of this just naturally went away. And I didn't at the time, this was before all of my training, I didn't understand that connection. Right. And so I had been doing tons of physical therapy and like really paying attention to this local area and completely ignoring the concussion. And the pain never budged. It just didn't go away until I got my brain working better. So I've experienced that personally, and I see that play out with a lot of patients who I'm usually the end of the road, right? Like people have already usually tried every other therapy out there before they're like, okay, I guess I'll try acupuncture. So I'm usually at the end of the road. People have already tried everything else. They're still in a lot of pain. They're still having a lot of symptoms. And that's where, you really get to put your education and knowledge and tools to the test some of those difficult cases. And what I love is that, again, if you can get the brain working better, the acupuncture, through acupuncture and all these other therapies that we integrate, a lot of times that helps to improve the map of, let's say we're talking about a shoulder, for example. If you improve the brain and the map of the shoulder in the brain, all of a sudden what people say is, okay, instead of my entire arm hurting, now I can really pinpoint to one specific area that's still bothering me. And when I hear that people's pain have become much more localized, I know that we're improving not only their local injury, but how their brain is mapping the body at the same time.
Yeah, that's pretty amazing. Yeah. And I think, you know, that's actually something that we haven't talked enough about, I don't think, in any of these series, is the pain component and the brain. So yeah, great information. And thank you so much for being here today. And all your information is below this video, but if anyone wants to get in touch with you, they can head to your website, healingresponseneuro.com. And they can follow you on Instagram and Facebook at Healing Response. And if anyone's interested in learning more about you or seeing if you're a good fit, they can schedule a free 15-minute consultation with you, correct?
They can do that directly through my website under the appointments tab, or just shoot me an email or phone call and we can set that up.
Awesome. Well, thank you so much for being here today, Dr. Wolf. This has been great information. Thanks for watching. I hope you enjoyed today's video. Be sure to hit that subscribe button so you don't miss any videos in this series. Like this video and head to Amazon to purchase Concussion Discussions.